Hello everyone, welcome to another episode of Health Talk Show. As always, I am here with you, Polly Kormukar, and to enlighten you with more health facts and relevant issues, we have some distinguished guests from Bangkok Hospital, Thailand. So let's not delay and let me introduce you to the team first. At first, I'd like to introduce Dr. Rudrak Prasad, Director of the Bangkok Neurosurgery Department. Hello, Doctor.
Hello, nice to meet you.
Nice to meet you too. Then Dr. Chaisik Damrikat.
Yes, hello.
Hello. He's neurologist, behavioral neurology and memory disorders.
Yes.
Dr. Chazira Satukichai. He is clinical immunology. Hello everyone, welcome to our show. So we will start with Dr. Rudrak Prasad. How are you,
Yes,
Doctor?
I'm good.
Is this your first time in Bangladesh?
Yes, this is my first time. Actually, I want to come here for a long time, but don't have a chance.
So we're lucky to have you here today as if your first time. So Doctor, my first question to you, as you are the Director of Neurosurgery Department of Bangkok Hospital. So would you like to know about more updated facilities at your department?
We want to be excellent for the treatment of neurological patients, so we have to have a best, at least, instrument for help us to treat the patient. We've got a high-resolution MRI scan, we got a high-speed CT scan, we got a digital subtraction angiogram, we've got a PET scan. Okay, that's for diagnosis of the patient. And we have like a minimal invasive surgery. We use microscope, we use endoscope in order to minimize tissue trauma for the patient. We use neuro navigator, we use neuro monitor during the surgery in order to make the patient safety.
Okay.
Okay, that's
good.
the part
That's
of
good.
our machine.
Okay. That's good for the patients, of course. And it's high-class treatment at your hospital,
Sure.
of course. So as you got a lot of patients from Bangladesh, I'm sure of this. So what kind of common symptoms you have noticed from them at neurology?
So I have a wide range of the patient from Bangladesh, from like cervical degeneration, back pain, or brain tumors, or even the brain bleeding.
Okay.
So they come to Bangkok Hospital and they trust our hospital and become like a permanent patient of Bangkok Hospital.
Are they come, most of the cases, at the last stage, or their situation is it curable?
Yes, both early and the last one that my patient and also Dr. Chaisak, patient is bedridden for many months.
Okay.
And finally went by air ambulance to our treatment. And now patient is, he can walk by himself. And
That's a good recovery,
yes,
of course.
very good recovery.
So this is good for them if they come earlier to you
Yes,
guys.
sure.
So Doctor, do you have any advice for the audience of us?
Yes, we are waiting to help the treatment of the patient. Just let me know. Our team knows about the symptoms and information about the symptoms and disease of the patient. We will check is there anything that we can improvement for the treatment. If the treatment is good enough, maybe patient don't have to transfer to our facility. But if we have a chance to make the treatment better, we will arrange the plan of the treatment for the patient.
Thank you so much, Doctor. I'd like to come to Dr. Chaisik. Hello, Dr. Chaisik. Welcome to Bangladesh. How's your time in here?
Yes, it's very good. The food is so nice. I love them, yeah.
Thank you so much. So, Doctor, as far as I know, you specialize in behavioral neurology and memory disorders.
That's right.
So, it's a vast area, okay?
Yeah.
So, would you please share us some common types of syndromes at your department?
Yeah, normally the behavior is a very wide range of the symptom, but normally it's come with the patient with the Alzheimer's disease, Parkinson's disease, or also the depression in the elderly, because it's not common in the elderly to have the depression or anxiety or any behavior that's so odd, just like the thing or behavior that shouldn't do, they come to do something like that. It can happen in my specialty.
Oh, okay. As far as I know, Alzheimer's and Parkinson's are non-curable diseases. So could you please tell our audience some early signs of these diseases?
Yes, the early sign of the Alzheimer's disease can be with the memory problem. Yeah, when you can think that, oh, I am so forgetfulness, I don't remember the thing that I want to do. So it's an early sign. And some of them has the mood problems, just like the irritable moods, getting angry so easily. That's also the early sign of Alzheimer's disease. And for the Parkinson's disease, the most common symptom is has the hand shaking or also the slowness of the body to move. So if you notice some change in your body, just like the behavior, memory, movements, okay, let's come to see me, and maybe via the email or teleconference is enough to make sure that is there any possibility for the treatment until we make plan that you can come to see me and in person for the treatment and investigation.
If there have any treatment for these diseases at your hospital, you can also tell this to our audience.
Yeah, we have some treatment, but because most of them is the symptomatic and slow down the process of the disease, so it's not curable, but we can make them better, just like the case that Dr. Yorlak says. He had the Parkinson's disease too, so after we correct them for the disease, he can come back to walk.
Is there any prevention method of these diseases?
Yeah, to the audience.
Alzheimer's.
Yeah.
And is there any prevention method like doing any kind of maths or I have heard something like this?
Yes, to keep your brain active, think a lot and continue as with your work. Don't stop working, because if you stop your work, your brain stop function and will be gradually decline.
Okay, that's helpful. As I asked Dr. Prasad, would you please tell us about some common symptoms among Bangladeshi people you have noticed?
Yeah, I think that the most common is I meet most is the headache. And the second thing is the dizziness and vertigo, balance problem. And the third is the memory, that's my specialty.
Okay, do you have any advice for our audience?
Yeah, for the disease, if you have any disease that you think that is related to my subspecialty or maybe neurological disease, you can consult with me. But if you not fit in with my subspecialty, I can suggestion for you to transfer you to the subspecialty doctor that fit in with your symptom.
I have another question to you. What kind of diagnosis system you would prefer to typically use to identify the neurological conditions or diseases?
Normally, we use the taking history and physical exam to make the plan and some conclusion that what to do next. And the most investigation I do is prefer for the MRI scan and maybe the PET scan in some case.
Okay, thank you so much, Dr. Chaisek. I would come to again. So, Dr. Chanzira, welcome to Bangladesh. Is this your first time also?
Yes, it's my first time, and I'm very exciting for here and people and food and cultures here.
We are also so glad to all of you be here. Thank you so much for coming here. So, Dr. Chanzira, our first question to you, as you are the specialized on neuroimmunology. So could you please share some of your symptoms, like audience, most exciting discoveries at your department?
Okay, so maybe neuroimmunology, it seems to be difficult for understanding for the common people, right? But actually it can present it in any symptoms, like even common symptoms like a pain, headaches, confusions, memory loss, or even the weakness. It can relate it to the immunologies or autoimmune disease. And the most exciting of the recently discovery is what we able to detect new antibodies that can relate it to tumor, and we may able to predict it. Like some patient, if you have these antibodies, in 5 years you may have some specific tumor, and then we can prevent it. So this is a very new, and always we detect new antibodies every years. Then we can find the incurable disease to be curable.
Oh, that's so nice.
Yes.
So nice. So I want to ask a basic questions about headache. So what's the difference between basic headache and migraine? I'd like to know.
Actually, the basic headache we call like attention type headache. So you can have headache from the common thing. Example is the beeping of the car outside on the street is make you annoying, is make you headache. So those kind of headaches
Also
is,
work stress maybe.
yes, and it's not very strong. Normally, if you rest, you will get better. But if it's a headache from migraine, it's very hard headache, it's very strong headache. You can feel like a throbbing, like your heart throbbing. It can be one side, and it can make you feel nausea and vomitings, and it can last like over more than 4 hours. So if you have these things, which is the same trickling can make the same headache, but the longer of period of time, the feeling severe, the feeling of nausea, that may be related to migraine more than just a common headache.
And is it like dangerous for people to having migraine for the long time? Is it?
Well, if you talk about this 10 years ago, we can say it's okay. You can be having migraine for many, many years. It's not serious because lots of people have migraine for a long time, right? But actually, when we study, we found some lesion in the brain that related to migraines, and it can cause like a microvascular constrictions. So that means if you have a migraine, untreated migraine, first it's annoy your life. Your work is not effective, your sleep is not good, even with your spouse, you have fighting because you don't feel well, right?
Everything is falling apart.
And
yes.
also when we have menstruation, we have headache as well. So that have been involved in your mood and your daily living. So currently there are many treatments for migraine, even the new treatment like injectable medications to prevent migraine, like more than 80% that the migraine can go away. So I think if you suspected of migraine, the best way is seeking the medication, because most of the patients just try to live with it without medication.
Exactly. In Bangladesh, it's also very common scenario to live with headache and migraine, whatever it is.
And they're scared of the medications, right?
Exactly. It's very alarming, and it's very also helpful what you have said already. And now I'd like to ask about some major complaints you have noticed in Bangladeshi patients. Would you please tell us?
Well, actually, the major complaint that I saw is pain, and mostly is predominant in women. Like they come with a pain from this area up down to their bodies. And I know the Bangladeshi women work a lot. They are mothers, they're working hard to take care of their children, and they take care of their husbands.
They take everything.
Yes, and they have a lot of stress. Exactly. And those cause the pain, and they are confused that is this the pain from the nerve or is a muscle pain. So this is the common disease that I saw.
Okay, now I'd like to ask you about some updated facilities at your hospital, about your department.
Yes, so our hospital have a very advanced since the beginning. At first, we have almost 20 neurology in many subspecialties. Like you can find a headache specialist, stroke specialist, epilepsy specialist, me, and autoimmune disease, a very rare disease, and behavioral specialist. So when you come here, if you have more than one problem, you can see all the expertise. The second is we also using the facility like a MRI and advanced MRI, really high technology MRI. And the radiologist that reading the MRI, also an expert in neurology. So they are not just a normal radiologist.
Everyone is specialist at their department.
They are specialists in the field. And we do have like Dr. Yodlak say, PET scan, also the new things that can help definite diagnosis for Alzheimer's disease.
Okay, thank you so much. Now, please tell something for our audience, any advice or suggestions you'd like to add.
Okay, so for the autoimmune disease or any neurological disease, unhealthy lifestyle has a very impact in the risk factor and is even a trigger for the neurological disease. The unhealthy lifestyle like obesity, smoking, sleepless or stress, and also low vitamin D can cause a lot of neurological disease or also some autoimmune disease. So if you want to prevent yourself from this kind of disease, the best way is to live healthier and choose on a good diet. And sleep also very important. But the key is if you suspected that you may have this kind of disease, you get the treatment at the right time and the right treatments can be preventions and it can be even changed, like Dr. Yodlak said about the case that untreated case became curable. So this is a very important to detect yourself early and treatment early.
Thank you so much, all of you. We have some wonderful time, all of you, and thank you again for your precious advice for our audience. And audience, we are just at the end of our show. I hope you have benefited enough from this doctor's talk and conversations. So till the next episode, stay happy, stay healthy. Thank you so much.
Thank you.